talk to you about chiropractic care and asthma. And you might not know this, but chiropractic care isn't just for pain, it isn't just for muscle spasms, but actually can have a really positive impact on asthma. Who would have thunk it, right? Asthma, what does that have to do with getting adjusted or reducing pain? Well, here's the thing. When you're having an asthma attack, there are different reasons for that. And I'll go into that in just a minute. But what happens is that your central nervous system, which controls all of the other systems in your body, right? So it controls your respiratory system, which is the system that is impacted when you have an asthma attack. So when you have an asthma attack, what happens is your airways can get narrow. You can have a lot of swelling. You can have a lot of mucus production in there. So it's hard to take a good deep breath in, right? And sometimes it's hard to actually get the air out. Now, those can be two different things. You can experience that both with asthma. You can experience that with COPD, chronic obstructive pulmonary dysfunction, all kinds of respiratory issues. But with asthma in particular, when you get a chiropractic adjustment, it impacts that central nervous system. When your central nervous system is working right, your respiratory system is working right, your immune system is working right. All of the other systems in your body can work better and work more efficiently so that it can actually help reduce asthma attacks. And I want to throw in a little thing about that. I also once had an asthma attack, and this was an attack that was induced by the powder that comes from the airbag. I had been in a car accident a couple of days earlier. I was working at a clinic and I started to have this attack. I couldn't breathe, and I thought, I'm not having an anxiety attack. I know what that feels like. I'm not having a panic attack. What is going on? I can't catch my breath. So I went panicked into the chiropractor's room because he was right next door to me. And I said, Mike, I can't catch my breath. I think you need to call 911. I think something's wrong. He said, okay, hang on, Deb. Take a breath. He tried to calm me. And in the middle of that, he gave me a chiropractic adjustment, and it literally stopped that asthma attack in its tracks. And then the kind of cool thing was he actually did some acupuncture because he was an acupuncturist as well. And he did some acupuncture on me. 2 days later, I went back in. He did one more session, got me adjusted, did some acupuncture. I never had another asthma attack again. So that's pretty powerful stuff. Your central nervous system is pretty amazing. And when you allow it to do what it needs to do, when you clear all those pathways, when your nerves can do what they need to do, you can really get a lot of true healing with your body. And asthma is one of those things that people don't even realize that chiropractic care can help with, but I see it all the time. Chiropractic care, asthma and allergies is another really big topic. I think that probably I could do a podcast on that one, but getting a chiropractic adjustment in the cervical spine can also really help with allergies. I have people who come into me, maybe they had a car accident, maybe they, were just hurting, or they're sitting at these makeshift desks in their homes because they were sitting home for a year working from home and the chairs are too tiny or their desks are too small, or, you're not sitting ergonomically correctly, and you start to have issues like that. And it's pretty incredible. By getting an adjustment, you can stop those allergies. And they say, I came in because I was hurting, but I haven't had to take allergy medicine in 2 months now. And it just occurred to me that the only thing I did different was come to see you, Dr. Deb, and get chiropractic care. So I think that was worth mentioning as well. We have a question coming in from Meredith. And Meredith is saying, is it true that chiropractic care can really help asthma attacks? And what causes asthma attacks? So Meredith, you know what? There are 3 really broad categories of asthma attacks. The first one is exercise-induced asthma. Some people don't have it until they go and start running or doing cardio or doing weight training, and then all of a sudden they have that constriction in their lungs and they can't get the air in, and they start to have an asthma attack. The conventional medical approach to that they use the inhaler so that it can open up those airways so you can get a breath in, because what you don't want is to go and not get oxygen into that brain, because then you can have some damage. The second type is called occupational asthma. That is when you have occupational irritants in your workplace that can cause you to also have an asthma attack. It could be fumes. It could be any kind of an irritant, dust particles in the air, anything that could really aggravate that respiratory system and cause you to have that constriction in your airways. A lot of that conventional approach, again, would be an inhaler. And the third type is allergy-induced asthma. And allergy-induced asthma could be seasonal allergies. It can be food allergies. It can be pollutants in the air, like something like smoke, a fire, something like that could actually cause asthma attacks as well. Here's another one that a lot of people don't know about is GERD. Acid reflux, indigestion can cause that constriction of those lungs, that feeling of that asthma attack as well. And your conventional medical approach would be things like Advair or medications that vasodilate. You could also take a more natural approach and do something like a nitric balance, which is nitric oxide. There are other supplements that you can take that help dilate those blood vessels, open things up for you so you can get that deeper breath in. Also, I know that I do yoga. That really can help, because part of yoga is breathing exercises and expanding those lungs and trying to be able to get as big a breath in as you can possibly get in, hold it, release it, and it's about training your breathing, and that can really actually help asthma as well. And one other thing I really think is important is cold air. So I actually do hot yoga, which is called Bikram yoga, and the warmth in there actually makes everything looser. My muscles looser. I can get into the positions better. I can stretch. I feel amazing. But I also notice that I can take a deeper breath by the time I'm through with my yoga practice for the day. So I hope that answers your question, Meredith. It's a great question. But there's a lot of different causes to asthma, big 3 categories, a couple of the other ones. And, who knows? I got a lot of podcasts to do, I think, because there's lots of stuff to talk about these days. You know what? We're getting to the end of our time together. So if you would like to email me, you can email me at feelbetter@lakepointwellnesscenter.com. You can go to my website at feelbetterhere.com, or you can give me a call at 770-974-5215. We can have a good old-fashioned conversation. Until next time, wishing you loads and loads of health and happiness. Bye-bye.